Welcome to the new year. Have you discovered that your Part D drug plan is not performing as advertised? Are the copays that you're being faced with at the pharmacy way different than what the plans that you were looking at before estimated that they would be for the new year? Hi, I'm Christopher Westfall, an independent Medicare broker. In today's video, I'm going to review an article that recently covers what those options are available to you after the annual enrollment period. Stay tuned. So here's the article from the Palm Beach Post. It's about a guy named Joel Lieberman who had quite the shock, as many of you have, even calling in here and saying, wait a minute, what the estimated prices were that I found on Medicare are not what I'm getting as I'm going to the pharmacy. Pay attention to the very end of this article because there is a solution. That's the reason I'm making this video. There is a solution at the end that you may want to avail yourself of. The title of the article says, I felt like someone was stealing from my pockets. A Wellington, Florida man says Medicare Plan Finder's drug prices unfairly skyrocketed right after the first of the year. So the article is from Wendy Rhodes, says Medicare denies there's a problem. For those that don't know, Medicare did change their Plan Finder tool right before October of 2019, right before the busiest part of the season. Everything changed. The interface changed, how it looked up drugs changed. It would not sort by the total out-of-pocket cost, which is the default from before. It's back to that now, but this was quite a major shakeup. And why they chose to do this right before the busiest season, I have no idea. We subscribed to a different tool that had all the numbers correct. So there was a disparity between our numbers and Medicare numbers, and now we're finding out that the Medicare Plan Finder tool, a lot of people have been saying it for the last couple of months, the tool is not working correctly, these numbers can't be right. Turns out those critics were correct, but Medicare still denies there's a problem. So back to the article. Medicare denies there's a problem, but Medicare advocates say something is amiss. Escalating costs are often inconsistent with typical fluctuations in drug pricing. Wellington, Florida. Joel Lieberman is a smart guy, a retired judge and trial attorney. He has tried countless medical malpractice claims throughout his career. He's defended doctors and hospitals in the Philadelphia area for 8 years before switching his focus to patients. In 2001, Lieberman, who's now 76, moved to Florida's West Coast, then relocated to Wellington in 2003. But in 2019, dreams of sunny days on the golf course gave way to a battle he never saw coming, a fight for his own rights against the nation's largest health care insurer, Medicare. Quote, I never expected that I would be a victim because I was always out there paying attention. Yet I didn't pay good attention this time, he said, of getting locked into a Medicare Part D prescription plan that would quadruple the cost of some of his drugs before the year was through. Like many people, Lieberman picked his prescription carrier using the Medicare Plan Finder, a website consumers rely on to compare Medicare plans and prices. He had been using Humana but decided to switch to SilverScript in 2019 because the price quotes were lower. He said the written quote through SilverScript for all 7 of his prescriptions totaled $98 per quarter. It's not a written quote, by the way. That's a mischaracterization of what it is. It's an estimated drug cost, again, using the tool. It's the tool that's estimating that. But the first time he went to CVS to pick them up in January, he was charged $147. By the second quarter, the cost had risen to $183. By the third quarter, it was $224. And by the fourth quarter, the prescriptions rang up at a whopping $242. Now, this happened for, obviously, the annual enrollment period for 2018 coming into 19. So this is even before this whole fiasco of 2019 for 2020 season. Interesting. Quote, I felt like somebody was in my pocket stealing my money, he said, and I wasn't going to let that happen. Reliable numbers? He called SilverScript to find out why the prices had increased so much. They told him, he says, this is third party, this is called hearsay, judge. They told him, he says, it was because the cost of medications were rising. Lieberman didn't buy it. Frustrated and a little suspicious, he contacted the Department of the Inspector General at the U.S. Department of Health and Human Services. We've covered plenty of their reports. For those who did not see the other video, just a quick highlight. 56% of Medicare Advantage companies inappropriately denied claims. According to the HHS study, the motive was to potentially profit from the capitated payment systems in Medicare Advantage. That's not my language, that's theirs. 56% of the companies have inappropriately denied claims. In 2016, to be exact, 45% of Medicare Advantage companies provided insufficient information as to why they denied those claims. This is the OIG study. This is the most shocking. Between 2014 and 2016, 70% of appealed claims were overturned or partially overturned. 70% of the time that they denied something or declined to pay for something, it was overturned if someone simply knew how to do the appeals process. The government office tasked with identifying, combating, and preventing fraud under the Medicare program. Quote, they told me there was nothing they could do, end quote, Lieberman said. So I asked, where does this fall? And the lady said, in a crack. In a crack, that's nice. Shocking as that response to him was at the time, Lieberman would discover it was not far from the truth. And he is not alone in his frustration. 100%, said Medicare advocate Sue Greeno, of how many Medicare beneficiaries could be affected by any problems or misquotes with the Plan Finder. 100%. Greeno works for the Center for Medicare Advocacy. They do a lot of good stuff. It's a nonprofit, nonpartisan law organization that provides advice and legal assistance to seniors struggling with the Medicare system. She reviewed Lieberman's case and found that his escalating costs were inconsistent with typical fluctuations in drug pricing. Quote, his was going gradually up every quarter, so it seemed like there were other factors at play, she said. In Lieberman's case, Greeno said his concerns are valid. However, because of the lack of transparency in drug pricing, it is impossible to verify. Oftentimes, she said, people think they have been misquoted when in actuality, drug prices actually did increase, or the subscriber simply does not understand the normal fluctuations in costs over a coverage period. There's all kinds of disclaimers. Medicare Plan Finder is a snapshot in time, not a guarantee that you'll pay those prices when you go to the pharmacy, she said. That explanation is not good enough for Lieberman. I'm lucky I can afford it, but a large percentage of the population doesn't have never-ending funds, he said, expressing concern for all those he dedicated much of his career to helping. The drug carriers have a responsibility to their members, he said. The world is relying on the information they provide to make a choice. Plan Finder lacks transparency. Whether or not the Plan Finder, Medicare Plan Finder, is misquoting drug prices is up for debate. Lieberman said it is. Greeno said it seems to be in some cases. The Center for Medicare and Medicaid Services, or CMS, which is the federal administrator of Medicare, says it is not, and it is. Quote, CMS has found that the Medicare Plan Finder to be delivering accurate information on both drugs and premiums. And we've seen some inaccurate coverage on the new Plan Finder, a spokesperson said in a written statement. Confused? You're not alone. Quote, for all things Medicare, it doesn't matter if you're a doctor or a lawyer. It's complex stuff, Greeno said. It lacks transparency and is extremely hard for people to understand. Medicare seemed to acknowledge the issues in a November 2019 statement. That is what I'm talking about. Quote, this year we overhauled the Medicare Plan Finder because it needed it. Advocates, beneficiaries, and oversight agencies told us that, and they were right. But then Medicare goes on to deny any problems. Quote, CMS has been distressed to see media coverage talking about glitches or malfunctions in the Plan Finder. It displays the most current and accurate information on premiums, deductibles, and cost sharing that Medicare Advantage and prescription drug plans provide, end quote. Unfortunately, it's virtually impossible to quantify how often drug prices may be misquoted through Plan Finder because unless someone prints and saves the original quote and all of the input data used to compile it, it can never be accessed again. Quote, there definitely are cases where you're getting a price that just doesn't make any sense. said Jack Hoadley, a research professor emeritus at the Health Policy Institute in Georgetown University in Washington, D.C. He goes on, a counselor that looks at this regularly can see a red flag, but to a regular consumer, that is not so obvious. If the plan finder truly displays the most current and accurate information, Lieberman's drug prices should drop in 2020. The same 7 drugs this year are estimated to cost $130 per quarter, which is an 86% decrease over the last quarter of 2019, but a 28% increase over the same period last year. Quote, I expect that the bait and switch is going to happen again, Lieberman said of the little faith he has in the quarterly price will remain as quoted. It's a gamble. I think I could get screwed again, he said. Misquoted or misunderstood. Greeno said it is difficult for Medicare beneficiaries to know if they were misquoted because drug prices often change for legitimate reasons, and insured patients can have trouble understanding the complexity of the way drugs are priced. She gives a basic overview. Prescription plan coverage and pricing varies depending on the carrier and the pharmacy. Plan deductibles range from $0 to $435 a year. Once any deductible is met, plans go into the initial coverage phase. During this period, the insured typically pays a copay or a flat fee based on a 5-tiered system. Tier 1 represents low-priced drugs. Tier 5 represents the highest-priced drugs. When the total paid by both Medicare and the insured reaches $4,020, the plan goes into the coverage gap or the donut hole phase. Remember, I did a video earlier where some people in the market were saying the coverage gap, the donut hole, is gone for 2020. It's not true. During this period, the insured pays roughly 25% of the price the selected plan has negotiated with the selected pharmacy. Once the total out-of-pocket drug cost reach $6,350, the plan enters the catastrophic phase, which is when the insured pays an average of 5% of the negotiated cost or a low fixed copay. Because of the different phases and because drug prices do fluctuate, an insured can experience dramatic price variations throughout the year, due in part to misquotes on the plan finder. Quote, this is extremely complex, Greeno said. Every person's situation is so different, but help is available. Despite its denial of problems with online drug pricing, CMS said they want to ensure beneficiaries are confident in their decisions and happy with the coverage they choose. The organization encourages anyone who needs help choosing a plan or has questions about pricing to call 1-800-MEDICARE, which is 1-800-633-4227. That number again, as they used to say, that special toll-free number again, 800-633-4227 for Medicare. And here's the important part. Quote, special enrollment periods after the normal December 7 cutoff are available to those who believe they have been misquoted or for a variety of other issues. Consumers can also contact their local Florida Department of Education. Well, that's the state agency that just helps people with Medicare, but they have no authority to actually change anything. Only Medicare does. Greeno stresses the importance of taking time each year to shop for the best plan. It's going to be different every year. I'm stuck, said Lieberman. When I went to look for other drug pricing, they're still within the cheaper range, the same one, SilverScript, that he had before. The point is, as has been covered in other articles, SEMA, the lady, the administrator for CMS currently at this time, has been making the rounds in the media, saying that if what you signed up for Medicare on, the basis of which you picked the Plan Finder tool, was this data that now has turned out to be inaccurate, wholly inaccurate. Like, you were estimated that your total cost for the year is going to be, $400 for the whole year, and suddenly you paid $400 the first time you went to fill it. Now, it's interesting side note to make sure that you understand, of these plans, unless it's like a tier 1 generic, most of the plans have a deductible. And so there is no coverage during the period in which you are satisfying that deductible. Deductible simply means you're paying that whole entire amount before insurance kicks in. Same with Medicare. Part A and Part B both have deductibles. If you have a Medicare supplement, it's paying that for you. depending on which plan you have, especially the Part A going into the hospital part. And for everybody on a Medicare supplement, Plan G, Plan D, Plan N, you're going to have a deductible to pay, which is Medicare's deductible at the beginning of the year. So that's the period in time deductible where no coverage is paid for you because you're getting up to that deductible period. Many people on the Part D drug plans every single year, and the people on Plan G Medicare supplement and Plan N Medicare supplement seem to forget the deductible starts over January 1st. So we're talking about the period outside of the deductible. Sometimes people will go with their brand new Medicare card or their brand new Part D prescription plan card and say, I got no benefit whatsoever. The price of the drug was $85. I had to pay $85. What do I have insurance for? Remember, after the deductible is met, then you enter that initial coverage period, which is when you're having your standard copays. So that little discussion aside, if you're seeing a wide variance in the fulfillment cost of your drugs, you are encouraged by CMS themselves to call Medicare and say, this is shockingly different than what I signed up for. The estimates that I were given from the computer system were completely whacked and they were off. I would like to look at this again. Is there any way, I read in the media that if I was given wrong information and now I find it to be completely different, I can call you and make a special exception for you. And they'll give you, they could, potentially, it's up to them, case by case basis, give you a special enrollment period, special election period, where you can then look at your drugs again based on their most current data. And you've got to exercise this with them at Medicare. You can't say, okay, can you give me a special pass and then I'm going to go to that broker over there and buy a Part D drug plan. That doesn't work. You have to effect that change while you're with them on the phone. So if they get it granted for you, if they allow you to do a special change, you've got to make that change with them on the phone. And they can look at the data based on what they have, the latest information. Since they did the revamp of the online plan finder tool, there have been changes and modifications and improvements. There were some in October. There's an agent community backlash through our advocate in Washington, D.C. all through October. There were some changes made in November. And now the default view works where you're going to see everything based on the total out-of-pocket cost, which is as it should have been, which is what it was before this whole fiasco started. So again, the point of this video, if you're paying too much for your drugs, if it's because your initial estimate of the drugs as you found it online or you got information from somebody looking online for you was way out of whack to what you're actually paying now, taking into account the fact that the deductible period offers no coverage, we're looking at the rest of the part of the year, you can call Medicare and request a special exception. It's not to say that that's going to be granted in every case. You have to plead your case, and it's got to be based on information that was provided by their tool that seemed completely inaccurate, and you're shocked at the difference. And according to what they're trying to say now publicly, they're going to handle those on a case-by-case basis and grant people a special enrollment period where they can put them into another drug plan. Important to remember, any changes affected by Medicare or during the Medicare open enrollment period, that's that period of time from January to March 31st where you can get out of a Medicare Advantage plan and go back to original Medicare or change to another Medicare Advantage plan. Any of those changes that happen with Medicare with regard to a Medicare Advantage or a Part D drug plan, they all happen on the 1st of the next month. So if you call Medicare and they grant you an exception and they find a different plan is best for you and they affect that change will happen on the 1st of the next month. It doesn't even matter technically if you did it on the last day of the month prior. All Medicare changes in that regard for Medicare Advantage or Part D drug plans take effect on the 1st of the next month. And we try to do that also on the Medicare supplement so that there's no overlap, so there's no trying to refund money on a partial payment basis and pro rata and all that kind of stuff. The 1st of the next month should always be the goal when effecting new coverage with regard to Medicare. My name is Christopher Westfall. I'm a Medicare insurance broker from coast to coast. We help people with their Medicare plans, Medicare supplements, Medicare Advantage, and during the Medicare season, or if new to Medicare, on their Part D drug plans too. If we can help you in my office, we're a completely unbiased, independent brokerage, and our service does not cost you anything. How can that be? It's covered in the premium. If you went directly to the insurance company, you're paying the same rate as if you went through us. It's just that they keep all the commission money that they've already built in there due to regulatory concerns. It's already built into the premium. They can't have one premium for direct-to-consumer business and then another premium if you went through a broker. It's all the same premium. So you get basically an agent service for free, and somebody will look out for you and shop the entire market. So if we can help you in that regard, please reach out to my office and let us know. Welcome to 2020. It's going to be a very good year. Some good things happening in the senior community, more choices, more options. And as we get into the future of Medicare, I believe we're going to even have a bigger expansion of the choices and options available to seniors, which is always good news. Thanks for watching. God bless you. Have a great day.
This is Kimberly. How are you doing today?
I've just recently turned 65, and this has been a very daunting and challenging undertaking as far as which way to go and who to go with. And a buddy of mine who has been dealing with you guys suggested picked up the phone and called you all.
Oh, good. We're here to help with all of that.
If you want to find out what your options are in Medicare, but it seems too confusing, that's where I come in. Hi, my name is Chris Westfall. I'm here in Washington, D.C. this week, making sure that I'm up to date on what's happening with Medicare so that you can know what your options are. Push the button below. Be happy to help you with your Medicare choices so you have all the information.